Smoking is an unhealthy practice in which a person inhales and exhales smoke produced by burning tobacco, usually in the form of cigarettes, cigars, or pipes. Tobacco contains a highly addictive chemical called nicotine, which can cause physical and psychological dependence. Smoking is a major public health issue and is responsible for a range of negative health effects, including respiratory problems, cardiovascular disease, cancer, and reproductive problems. It is estimated that smoking is responsible for over 7 million deaths worldwide each year. Effects of smoking. Smoking can have a wide range of negative effects on the body, both in the short term and the long term. Here are some of the common effects of smoking. Respiratory problems. Smoking can cause a range of respiratory problems, including chronic bronchitis, emphysema, and lung cancer. It can also worsen existing asthma symptoms. Cardiovascular problems. Smoking can damage the heart and blood vessels, leading to a higher risk of heart attack, stroke, and peripheral artery disease. Cancer. Smoking is a leading cause of several types of cancer, including lung, throat, mouth, esophageal, pancreatic, bladder, kidney, and cervical cancer. Dental problems. Smoking can cause a range of dental problems, including gum disease, tooth loss, and oral cancer. Reproductive problems. Smoking can cause fertility problems in both men and women. It can also increase the risk of complications during pregnancy, including premature birth, low birth weight, and stillbirth. Skin problems. Smoking can cause premature aging of the skin, wrinkles, and yellowing of the skin and nails. Weakened immune system. Smoking can weaken the immune system, making it harder for the body to fight off infections and illnesses. Secondhand smoke. Secondhand smoke can be harmful to non-smokers, particularly children and pregnant women. Exposure to secondhand smoke can increase the risk of respiratory infections, asthma, and sudden infant death syndrome, SIDS. How to quit smoking and manage cravings. Quitting smoking can be challenging, but there are many resources available to help you quit. Lifestyle changes. Quitting smoking often involves making lifestyle changes to help manage cravings and improve overall health. Eating a healthy diet that is low in sugar and high in fruits, vegetables, and whole grains. Getting regular exercise to reduce stress and improve mood. Getting enough sleep to help manage cravings and reduce stress. Avoiding alcohol and caffeine, which can trigger cravings. Finding healthy ways to manage stress, such as deep breathing, yoga, or meditation. Set a quit date and stick to it. Get support from family and friends. Nicotine replacement therapy. Nicotine replacement therapy, NRT, is a type of medication that can help manage nicotine cravings and withdrawal symptoms when quitting smoking. NRT comes in several forms, including patches, gum, lozenges, inhalers, and nasal sprays. NRT can be obtained over the counter or with a prescription from a healthcare provider. NRT is generally safe and effective when used as directed, but it may not be suitable for everyone. It is important to speak with a healthcare provider before starting NRT. Prescription medications. In addition to NRT, there are prescription medications that can help manage cravings and withdrawal symptoms when quitting smoking. Two common prescription medications are bupropion and varenicline. Bupropion is an antidepressant that can also help reduce nicotine cravings, while varenicline is a medication that works by blocking the effects of nicotine in the brain. These medications can have side effects and may not be suitable for everyone. It is important to speak with a healthcare provider before starting any prescription medication. Behavioral therapy. Behavioral therapy can be a helpful tool for quitting smoking by addressing the psychological aspects of addiction. Behavioral therapy can be delivered in several ways, including individual counseling, group therapy, or online programs. Some examples of behavioral therapy techniques that may be used include cognitive behavioral therapy, CBT, which helps change negative thought patterns and develop healthy coping skills. Motivational interviewing, which helps increase motivation to quit smoking and build confidence in quitting. Contingency management, which provides rewards for achieving specific goals related to quitting smoking. Alternative therapies. Some people find that alternative therapies can be helpful in managing cravings and reducing stress when quitting smoking. Some examples of alternative therapies that may be beneficial include acupuncture, which involves inserting needles into specific points on the body to promote relaxation and reduce cravings. Hypnosis, which involves guided relaxation and visualization to help change negative thought patterns and reduce cravings. Mindfulness meditation, which involves focusing on the present moment and cultivating a non-judgmental awareness of thoughts and feelings. What happens after cessation of smoking? 1. 20 minutes after quitting, your blood pressure and heart rate will begin to drop. 2. 12 hours after quitting, the carbon monoxide levels in your blood will decrease, allowing more oxygen to reach your organs. 3. 2 weeks to 3 months after quitting, your circulation and lung function will improve. 4. 1 to 9 months after quitting, coughing and shortness of breath will decrease, and your risk of lung infection will also decrease. 5. 1 year after quitting, your risk of coronary heart disease is half that of a smoker. 6. 5 years after quitting, your risk of stroke is the same as a non-smoker. 7. 10 years after quitting, your risk of lung cancer is half that of a smoker, and your risk of other cancers, such as mouth, throat, and pancreatic cancer, also decreases. 8. 15 years after quitting, your risk of coronary heart disease is the same as a non-smoker. Benefits of quitting smoking. Quitting smoking can have a positive impact on your health and well-being, including improves lungs function and stamina, reduces heart diseases, dental problems, fertility problems. Remember that quitting smoking is a process, and it can take time and effort to break the habit. Be patient with yourself, and seek support from loved ones or a healthcare professional if needed. With the right tools and strategies, you can successfully quit smoking and enjoy a healthier, smoke-free life. Thanks for watching. Please subscribe the channel.